Hello, and thank you for watching the School Health Services Program Annual Training for 2024. This is the Department of Healthcare Policy and Financing updates for annual training. You'll also hear us referred to as HCPF throughout the training. My name is Olga Ginchin, and I am your School Health Services Program Administrator. Here's a list of acronyms that may be used throughout the presentation. I'll do my best not to use the acronyms, but if I do use one, you can always go back to this list and see what that acronym stands for. Here's my agenda for today, and I'll get right into it with our HCPF updates. The Centers for Medicare and Medicaid Services Comprehensive Guide was released on May 18th of 2023. There are a couple of areas in the Colorado program that are going to be changing as a result of this guide. However, participants will be notified prior to any program changes, and they will be incorporated into training sessions in the future before those changes go live. Until that time, if you're looking at the guide or if you are part of any conversations related to the new comprehensive guide, please direct any of those questions to probably myself at HCPF. Because we have a legislative requirement that requires us to report how many children are served by this program every year, we do not anticipate any changes around the direct service billing. So though that direct service billing, the current process will stay in place. Keep in mind that Comprehensive Guide is a nationwide document, and so the other states that participate in the program are in various stages of implementation of what's recommended in the guide, and they look very different depending on which state you're looking at. If you've ever been to the conference for the National Alliance for Medicaid and Education, you know that if you have seen one state's Medicaid program for school-based services, you have seen one state's Medicaid program for school-based services. Colorado already has those 1/12 interim payments. They have already expanded beyond the IEP services, so we have already expanded to free care. And we've already expanded provider qualifications so that you're able to put providers like school psychologists and speech language pathologist assistants on your staff pool list. The two areas where we will be changing the program in Colorado based on this new comprehensive guide is transportation. Moving forward, when the new changes are implemented, bus aides will no longer qualify a specialized transportation trip alone. If a student's IEP, that individualized education plan, has another modification on the vehicle, such as a lift or a specialized harness, then that trip would qualify for a specialized transportation trip. However, just the presence of the bus aid alone will no longer qualify that specialized transportation trip. You will still be able to claim for the salaries and benefits of those bus aides on your annual cost report, but this is just talking about what qualifies a specialized transportation trip and not. And again, that bus aid alone will not qualify the specialized transportation trip. The other area that we are currently analyzing the impact of these mandatory changes is the random moment time study. We are looking at how it is going to impact the time study in the state of Colorado to have a longer time study and fewer moments. The comprehensive guide does allow to have fewer moments, and we're analyzing how the change would take place in Colorado to start the random moment time study at the beginning of the school year and potentially also having a summer time study. Here is the timeline for the comprehensive guide. This should look familiar from before. Of course, the CMS comprehensive guide was issued back in May of 2023. Last fiscal year and this fiscal year, we are analyzing the impact of those two areas that I just mentioned. And then moving into fiscal year 2025-26, we will say, okay, we know what we think that these changes should look like in the state of Colorado, and then start working with CMS to approve those changes to the PCAP, which is the document that guides the administrative claiming side of the program, and the state plan amendment, that SPA, that's the document that guides the direct service part of the program. You will notice that we do have an updated deadline. The CMS Technical Assistance Center, the TAC, did issue some frequently asked questions, and they clarified that the effective date for these changes needs to be July 1 of 2026. And again, the School Health Services program is business as usual. Nothing changes right now. We are working on these changes, and when the changes are approved and we know what it's going to look like in the state of Colorado, we will incorporate that into training. There were some additional resources that came out along with the comprehensive guide. Again, because this is a nationwide document, the resources in the state of Colorado will continue to be HCPF, myself, Colorado Department of Education, and Public Consulting Group will be your first points of contact for any program changes. That Technical Assistance Center was established by CMS, but again, they are supporting all states across the country, and we continue to be the best resource for how things work in Colorado. You may look on the Technical Assistance Center website and find some live and recorded webinars. You might see some familiar faces out there, and there are also some frequently asked questions. Senate Bill 23174, we added behavioral health service codes to the program starting July 1 of 2024 as a result of this Senate Bill 23174. They are available for qualified psychology, counseling, and social work providers. And if you want to know what those procedure codes are, you can take a look at the billing and program manuals. They've both been updated. Just a reminder that because the school districts receive that reimbursement through that cost-based mechanism, the addition of these procedure codes doesn't necessarily increase your reimbursement. Fee-for-service claims continue to be paid at zero because, again, you do receive your reimbursement through that cost-based mechanism. However, if you use one of these procedure codes on a day that you have a qualifying transportation trip and your district or Board of Cooperative Education Services, the BOCES, you could increase your transportation reimbursement if your district or BOCES participates in transportation claiming. Community providers in schools, we did receive clarification from our federal partners that community providers can bill fee for service in schools. And when I talk about community providers, I mean a provider that is not contracted with or employed by your school district or BOCES, and they want to come in and provide a health service to a student at your school district or BOCES. That does not mean that anybody can come in. They just still have to go through the processes that you have in place at your district or BOCES. Whatever background check you have, whatever process you have in place. And of course, that can vary greatly from district to district. They still have to abide by those policies in your district or BOCES. The letter that was released in May contains a lot more details, and it's linked there for you. Just remember that providers are not allowed to bill both fee for service and be on the School Health Services staff pool list. That also includes that the community providers can't be on any time studies regardless of if they are providing those services at a different district or BOCES. So please make that part of your screening process when you're deciding whether to allow these community providers and how they bill for Medicaid reimbursement within your school district. National Provider Identifier and PI requirement, we are now in the full implementation of this requirement. So these individual physical therapy, occupational therapy, and speech language pathology providers have to have their NPI and include that NPI on their services starting with July 1, 2024 or later. Having that district or BOCES NPI is no longer valid. And keep in mind, just getting the NPI, that is really the easy part. The more difficult part is completing that Medicaid provider enrollment. That does take a little bit more time than just simply getting that NPI. Those services with invalid NPI OPRs will be denied. Keep in mind that you have that 120-day timely filing requirement. So depending on when you're watching this recording, you may still have time to review services from fiscal year 2023-24 for any errors while they're still being flagged but paid. Again, starting in 2024-25, those services will be denied. Service documentation is required for providers to be on your direct service staff pool list. Remember that this is a CMS compliance requirement. These are federal matching funds that you receive through the School Health Services program. And in order to continue receiving those funds, you have to have these valid NPI OPRs on all of those PT, OT, and SLP services. Here are some tips for the NPI requirement. There are step-by-step instructions and frequently asked questions included in the NPI OPR guide online. So start there. You can use Gainwell at the provider call center or in the provider portal to see if a provider is enrolled or troubleshoot. If you are having any issues getting the Medicaid provider enrollment completed, please contact me directly and include an application tracking number and the details of the unresolved issue. I need some context in order to be able to escalate that case. And of course, you can always reach out to me for any general questions. Use that NPI after the steps are completed, and then you'll have time to correct those issues within the timely filing period. Monitor those claims and interchange to ensure that program compliance, and keep in mind again that those claims with an invalid OPR NPI will be denied. And the biggest part of that, again, the most timely part, time-consuming part, is that Medicaid provider enrollment portion. Revalidation resources. There was a special provider bulletin that was emailed out on June 17th of 2024 that I thought included some really helpful resources for revalidation. Now that you're not only responsible for completing that district and BOCES revalidation, but your individual PTs, OTs, and SLPs have to complete revalidation as well. The revalidation website includes a lot of great resources. The one that I thought was most helpful was the spreadsheet by provider type that has revalidation dates by NPI and provider ID. So you should be, as a best practice, keeping track of those NPIs from your PTs, OTs, and SLPs. And you can use that NPI to just quickly look up when your providers have their revalidation dates due. School Health Services program stakeholders, we have a group of more experienced program coordinators from across the state that really help us in a variety of areas with the School Health Services program. They help us with information dissemination. They have a good amount of program knowledge. They have been more involved in the annual training this year to try to increase participation in our virtual training sessions. They led our virtual breakout groups, and that was one of the suggestions that they had in our April 2024 stakeholder meeting. So that was a great suggestion by our stakeholders. They also help us with our monthly mentorship meetings, and most recently they've been helping us with the feedback regarding those comprehensive guide changes and really what is best for those changes and how they should be implemented in the state of Colorado. Here is a map with who our stakeholders are. We have stakeholders represented in the regions across the state. These are the CDE regions, and we also have a community partners stakeholder. Those three stakeholders are the 3 billing agents that are approved in the state of Colorado. We also have a drop-down that was our previous stakeholder areas of knowledge grid. You can look on the main program website. There's a blue banner that has the drop-down and filter on if you have a question in a certain area of the program and you would like to reach out to a stakeholder who has a good amount of knowledge in that area of the program. You can reach out to the stakeholder using those drop downs who has said that they have a good amount of knowledge in that area of the program. New coordinator mentorship, we have an email that I have sent out to new coordinators in the state that includes resources, program contacts, training links. You'll also have monthly mentorship sessions starting in September that include fellow new coordinators, at least one stakeholder representative. I like to get a different stakeholder representative to attend those monthly mentorship sessions so that new coordinators can get different perspectives from a variety of different stakeholders and districts and BOCES. We'll also have a representative from CDE, that's usually Tyler, HCPF, that's usually myself, and at least one person from Public Consulting Group. You should have already received a sign-up email. And then we'll have a more in-depth training session during our mid-year training. That will be towards the end of January or beginning of February. National Alliance for Medicaid and Education, the NAME conference, is coming up in October, and we're very excited that this year it will be held in Denver. It's going to be at the Marriott Tech Center. That's located around the intersection of 225 and 25, so a good central area for the metro area. There will be general sessions from our federal partners like Centers for Medicare and Medicaid Services, the Office of Special Education and Rehabilitative Services. There are breakout sessions and a lot more. You'll probably see at least one or two sessions from Colorado folks. And it's a great opportunity to just go out there, network with some other states, also just network with people from Colorado and get a little more perspective on why the program has these certain requirements and really what's being asked of the Colorado program. We're well represented on the NAME leadership team as well. I'm your membership committee chairperson. Shannon Huska is the State Medicaid Agency Region 3 representative. Marley Hart is your NAME board secretary, and Maria LeBlanc is your program committee chairperson. And not only do we have a really good representation on the NAME leadership team, we usually have a really good representative from Colorado as well. We're hoping to get even more Colorado folks to attend this year, and maybe your travel budget didn't allow for your full team to attend because it was out-of-state travel, and we're hoping that just having it in Colorado this year, it'll be a little more feasible and within your budget so that we can have a good representation this year as well. Here are some program resources. We do have a new general email address for the School Health Services program. Would highly recommend that you make that your main email address for the program. Office hours are starting again in September. Keep an eye on the interchange billing system. not just to make sure that those services for NPI OPRs are meeting their requirements, but also just that all of your services are going through. Sure that you are familiar with your contract with HCPF so that you know what you're contractually obligated to do for the program. Keep an eye on the newsletters. If you haven't already signed up for newsletters, please do that. That's also listed on the website. We will be including a list of frequently asked questions from the School Health Services annual training, so keep an eye out for that. And of course, the program manual and website. If you just have one bookmark for this program, please let that be that main program manual. PHE Unwind update. I wanted to give you some resources for outreach, and please just take a moment. I know that districts and BOCES communicate with their families in very different ways. There are a variety of resources here that I think will meet the needs of any district or BOCES, regardless of how you prefer to communicate with families at your school districts. There is an annual stakeholder webinar coming up on August 27th. Be sure to register for that. When I'm talking about stakeholders, I'm talking about stakeholders that are related to the broader HCPF organization, not just our school health services stakeholders. So anybody is welcome to attend these annual stakeholder webinars. There are toolkits to support member renewals. These are available in the top 11 languages that are spoken by members in Colorado. There are flyers that can be printed and customized. I think this could go home in a Friday folder or maybe uploaded to a virtual Friday folder that are available to families at your school district. The Health First Colorado renewals page really guides members through the renewal process, and it's available in both English and Spanish. I have forwarded you all some resources from insurekidsnow.gov that helps with outreach resources to help make sure that your families are covered. And you can also get these flyers printed or customized and help these get out to the families in your school district. There are appeals resources available in both English and Spanish. And really, you can keep Colorado covered. There are so many resources here. Again, just take a minute to just find what works best for your district and BOCES. This is just not only important to make sure that families in your school district are enrolled in Medicaid if they qualify for it, but also it helps them find other health coverage options. So if they aren't eligible for Medicaid, they could perhaps find a different option that is available to them. Of course, we want to make sure that families have the coverage that they need. That's, of course, very important. But it also helps because if they are eligible for Medicaid, it helps increase your Medicaid enrollment rate and also your IEP ratio. And those two percentages are applied to reimbursement for your school health services reimbursement at your district or BOCES. So not only just making sure that those families have coverage, but of course, that can also help get more reimbursement dollars back to your school district or BOCES. And thank you very much for watching today. You're always welcome to reach out to me directly. You can use the phone number that's listed at the bottom there or that general school health services email address. And appreciate you watching. Let me know if you have any questions and have a great day.